Welcome back to the Health Tip. So we're continuing on our series about the importance of the curve in the neck. So this is a sort of a abstract thing that a lot of people wouldn't even think about, but we find this a lot. So as I mentioned in the other videos, when we lose the curve in the neck, there's a lot of potential problems. And one of the least obvious problems, but it's a pretty common one that we find very often when we do some of our testing, is that inside the spine is the spinal cord. Okay, so your brain is up here. This is sort of like your brain stem. Just think of this yellow thing continuing down between that canal and the bones in your back. I can show you this little model here. So if I take out two bones from your back and turn it this way, so these are those bumps you see on the back here, like that. This thing here is your spinal cord. So that's billions of nerves coming from your brain down through the bones in your back. And as they go down, little branches of that come off, and these would be the nerves going out to control different body parts. So inside your spine, the spinal cord itself is actually tethered or connected to the bones only in a few areas of the spine. So there's a couple up here around the occiput here, there's one or two in the first vertebrae, a little bit down by the fifth, and then it's also kind of anchored way down here at the bottom, at the coccyx, the tailbone right down at the bottom. So it's kind of fixed here, fixed at a couple areas up here, but it's kind of free in this whole canal at the bottom. But watch this, if this is connected here and it can't really move, if I have the spine with the proper curves in it, inside here, that spinal cord is actually nice and relaxed. But if I do this, I'm actually elongating that and I'm pulling the spinal cord. Nerves don't like any pressure on them, but they hate being stretched. Even just like 2 to 5% of stretch on a nerve can actually decrease its functioning a lot compared to putting pressure on it. So when we lose that curve in our neck, it actually pulls the spine. It's kind of like tethering it. And one of the surprising consequences is that because it can't move down here, these nerve roots down at the bottom here that are coming out controlling the low back stuff can actually be under a lot of tension. And if somebody has disc bulges or things going back into this canal, it can actually pull the spinal cord tight against those, causing more inflammation, causing more tension. And surprisingly, just kind of ballparky, we say maybe 70 to 80% of people that have low back discomfort actually have that pain in their back, not because there's a mechanical problem here, but because they've lost this curve in their neck, this forward posture. And if you look around right now, the incidence of back pain, pain in back and anywhere parts of the spine in children is going way up. And if you look at what we're doing with our devices, they're all doing this now. It's going to be a big problem, like really epidemic. So we really need to get our handle on this stuff and try to do as best we can to kind of get kids, working and getting their spines checked as regularly as possible, and try to, modify how they're using their devices and all this kind of stuff. I've had some other videos about that too. But it's a really important thing. So this is one other big consequence of losing the curve in your neck and not having this checked, is that people will actually have low back pain, even tension, sometimes pain going down the legs because the spinal cord has been pulled so tight that the nerve roots down at the bottom are actually under tension and getting inflamed and causing even pain and symptoms down into the legs can even be a result of this. Here's an example of that. This patient, his major complaint was sciatica pain going down the leg. Couldn't sit still in meetings, he was at work and was always fidgeting, couldn't sit still. So we worked on him for a little bit over a month, and now he says he's about 90% gone, and he can sit still in meetings, not taking any medications anymore. Really good success, but I just wanted to show you what the scans look like. So his complaint was down here, leg pain going down his leg, right? But these lines, the length of the line indicates how tight the muscle is. So if you look at these lines here, white would be normal, green is a mildly high tension, blue is moderate, and red is severe. So that's more than 3 standard deviations away from normal tension. So if you look at his model here, this was the first time he came in. So fairly normal tension along here and along here, mild down at the bottom, but not much. But look at how much there is up here in his neck. That's a huge amount of tension to be in the upper vertebrae. And that excess tension, the forward posture that he has, all of that can lead to what we call pulling and tethering and excess tension down here, and here he has all this pain down his legs. So this here kind of shows what we call the energy flow, so where there's this huge break on that side, so this is where the energy is kind of like there's a big block in the dam there, and that's not allowing anything to come from the brain down into the body and causing problems in the body sort of thing. So this was after about a month and a half of care, so he's been coming in, so you can see that all of this excess tension here has come down, especially on this side. So instead of just being concentrated on a couple of vertebrae, we kind of spread it out mildly over a few. This is only moderate. This one here is a little bit less, so there's less tension here. Still red, but it's less. So this is all gone, and obviously even the tension down here is all cleaned out as well. So it's much more symmetrical and balanced. There is still some excess tension. That's probably been there since he was a little kid, probably. Very often a lot of our tension in our neck comes from the birth process. And as you can see here, this is the flow diagram, so he's pretty much flowing almost completely within the pattern, and there's no big sort of block in the dam sort of thing to allow the brain energy to come down into the body, so to speak. A lot of these problems come from the birth process, so it's very, very common, however the baby's coming out, for doctors to actually pull on the head. We call it the Ritkin maneuver, so they kind of turn the head and pull it to clear the shoulders to get the baby out. And so, you know, sometimes it needs to be done, whatever. And even if you have like a cesarean section, sometimes they put a vacuum extractor or they use forceps, and they'll still pull out the baby very quickly with their hands. And very often that can cause problems up here. So most kids are actually starting life with a subluxation in their neck, and that can cause a lot of problems, especially when they're trying to turn their head. Sometimes that excess tension can cause pain and discomfort, and they're crying all the time and colic. But it can also hamper the development of that normal curve in the neck too, if that subluxation is very severe and it never gets corrected. Even when the child's starting to lift its head and turning it side to side, it might not have full range both sides. And if it's not turning its head properly both ways, then that neck curve might not develop properly right from birth. And then we're seeing, you know, 3, 5, 7-year-olds with the loss of curve already, like almost like it probably never even developed because of that stress. So this is a really important thing for the whole body. And I know there's some chiropractors that just work on this and people's low back goes away and they don't even touch the low back, right? So when this gets optimized, everything else has much more possibility to work properly. So that's your health tip for this week. Make sure your whole spine is working properly, especially your neck, and especially that curve in the upper neck. And we'll see you next time.